family practice, there are many family practitioners who are actually reducing their volume somewhat and really taking the time to understand billing and coding to be able to code for various skills that they perform in an office visit and for various interventions that they do. Maybe you have more experience with that and you can comment on that.
Yes, that's right. And there's certain number of things you're supposed to be able to have done to the patient in order to be able to charge a certain fee. And here again, the market's not being allowed to set the price. Each year, the amount of reimbursement that they offer for these certain number, they call them bullets, the things, you know, did you check the ears, did you check the eyes, and all of this stuff. The reimbursement for that same amount of work is being decreased each year, and therefore your reimbursement is decreasing each year, and so there's a pressure to see more patients, spend less time with a patient in order to make the same amount of money and have the lifestyle. This is, as I mentioned earlier, this is where the fraud has a tendency to creep in. The tendency is there to check maybe an exam you didn't actually do in order to get the certain amount of bullets so that you can charge the higher fee. In urgent care company that I worked for, we were under pressure. We didn't get our quarterly bonus unless you averaged 3.5 patients per hour. And that's, in my opinion, that's not the way medicine should be practiced. You need to spend the time with the patient. You know, we all talk of the bedside manner. Your bedside manner suffers when you're under pressure to get in there, check the heart, lungs, this is it, here, let me write you a script, have a good day. You know, that's what the current health care, these decreasing reimbursements is forcing medicine to do, and I think that's going the wrong direction.
You bring a good point, because even in psychiatry, the interventions that we do are based in time. And so as a result, even though we're spending longer periods of time, we're not necessarily getting reimbursed for that time. Prior authorizations are increasing. Many patients want to talk about their therapy issues and are dissatisfied when they're being seen also in psychiatry on the average of less than 15 minutes for medication management. And many of us have to refer on and say you have to check your provider list, you have to get a therapist that is underneath the health care plan, or you have to go to, like I said before, cash pay. So it's really across all specialties, whether it's family practice or psychiatry and even pediatrics.